All right, so we're going to talk about one of the disorders of the anterior pituitary gland, and this is acromegaly. Now, acromegaly is a medical condition that's caused by too much secretion of the growth hormone after puberty. And the reason why I highlight after puberty is because there is another condition called gigantism, which happens when there is too much secretion of the growth hormone before puberty. Now, the signs and symptoms are typically about the same, but it's just important for you to understand that there's after puberty, which is acromegaly, and then there's one that's before puberty, which is called gigantism. Now, big thing to understand, whenever growth hormone is released, the liver and the body responds by making another hormone that's called the insulin-like growth factor, which you see in your textbooks as IGF-1. Now, too much growth hormone causes the body to make too much IGF-1. So let's go ahead and break down acromegaly. Acro means extremities, and megaly is the medical terminology for enlargement. So when you put both together, this is a condition that causes enlargement of skeletal extremities. Often, although those are not the only body parts that may be enlarged, but typically it causes enlargement of skeletal extremities in a person. Now let's talk about some of the causes. Acromegaly is usually caused by a non-cancerous pituitary tumor that's also called a pituitary adenoma. So when you see this in your textbook, have an idea that it's referring to a pituitary tumor. Now, the tumor that causes acromegaly usually grows very slow. So most patients who have this condition may not actually notice the symptoms for a long time, sometimes over years, before they start to even identify that something bad or different may be going on. Big signs and symptoms to watch for in your exams. Of course, we said acromegaly, something that's getting bigger. So we're talking about enlargement of the hands, enlargement of the feet, protrusion of the jaw and the orbital ridges. These patients may have deeper voices, thick, coarse, and oily skin. Other things we see are organ enlargement, headaches, visual changes, and because of all those bones getting bigger, they also experience some joint pain and muscle weakness. With patients who have that tightness and growing of like the feet, you may hear patients complain about their shoes feeling tighter, their rings feel tighter on their fingers. Those are big things that sometimes may clue some providers into maybe looking into this condition with a typical patient. Now, diagnosis is made by blood test, where they measure that growth hormone or that IGF-1 that we talked about on slide 1. And then imaging can also be a CT or MRI, which you use to visualize that pituitary tumor or that pituitary adenoma. Now, treatment, surgery to remove that tumor. And if surgery fails, then they may move to radiation to destroy those tumor cells and reduce those growth hormone levels. Because think about it. If the tumor remains there, it's going to continue to stimulate that growth hormone to be released, which will continue to exacerbate the situation. And if that fails, medication to help keep the IGF-1 levels in normal range may also be used. Now, as the nurse, you need to think about what your responsibilities are for each condition. Advise the patient to adhere to all their prescriptions and keep all their follow-up appointments. And of course, this is always an important one for nurses, emotional support, because the diagnosis may be difficult for a lot of patients to accept. Now, big thing for you to keep in mind and don't forget. Excessive growth hormone increases the risk for insulin resistance, which then increases the patient's risk for increased glucose buildup in the body. So if you think about it, when there's too much glucose buildup in the body, this increases the patient's risk for type 2 diabetes. So when you see this on your exam and you're trying to figure out what is the connection between these two, just remember that excessive growth hormone increases the risk for insulin resistance, which then puts the patient at risk for type 2 diabetes. Okay, guys, that's the long and short of this. I hope that this helps you. Leave me a comment below if you have any questions or if you just want to comment on the PowerPoint itself, and then I will see you on the next one. Have a great day.